Good evening and welcome to I'm Chris Parnell.
Reporting from Moscow.
Tbilisi.
Times Square. May your dreams be your only boundaries in life.
Hello and welcome to Living Well. I'm William Kinley. According to the CDC, heart disease is the #1 cause of death in this country. With February being American Heart Month, we're going to talk today about how to keep your heart healthy. Here are a few heart facts. A normal heart valve is about the size of a $50. The first study showing benefits of a vegetarian diet actually appears in the Bible in the book of Daniel. The blue whale has the largest heart. It's as big as a Volkswagen Beetle and weighs half a ton. The heart beats 100,000 times a day, and each minute it pumps 1.5 gallons of blood. Kristen Bell, the director of the CVICU at Methodist Le Bon Germantown Hospital, is with us today. She has a lot of experience working with patients recovering from heart surgery. Kristen, welcome.
Thank you, William.
We're glad to have you.
Glad
Well,
to
I
be
guess
here.
start out maybe tell what is the CVICU and what do you do there?
It's a good question. It's a tongue twister. CVICU stands for Cardiovascular Intensive Care Unit. And at Germantown, we recover surgeries.
Okay.
We recover cardiac surgeries and other types of surgeries
I
that
see.
come out.
So with your cardiac surgeries, what types of patients do you see?
We see patients who have their open chest surgeries, so cardiac bypass. People call those CABGs for short.
Okay.
Some people call it open heart surgery. There's a couple of names just to dumb it down. Bypasses, triple bypass, double bypass. We see heart valve replacements.
Okay.
We see in the cardiac realm a lot of patients who have very major heart attacks that might not necessarily go to the operating room. They might go to the cardiac catheterization lab and come back with an extra device attached to them, and they need some ICU care, so they come to CVICU.
Okay. So it's intensive care.
It's intensive.
What does that mean?
Intensive care means that the medication needs, the nursing care needs, and the care from the physician is more intense than you would get on the floor. So your nurses are more frequently in the room, they're doing more things with you, they have a lot of machines that are hooked up to your body, so those machines kind of take over. It's just kind of a little bit more high intensity, a lot more things to do, a lot more changes can happen with the patients, so they're watched very closely.
Good, good. Well, when it comes to age, who can have cardiac issues?
You can have cardiac issues at any age. There are babies born every day with cardiac issues. When we talk about heart disease and cardiovascular disease, we see patients in their 30s and we see patients up to 100 years old. And it just depends on genetic factors, what happened in your family, did your mother and your father have cardiac disease? A lot of it is modifiable risk factors such as diet, weight, exercise, smoking is a big factor. So there's a lot of things that go into it. If you have a bad genetic history and then say you're a 2-pack-a-day smoker and you're overweight, you're more likely to be the guy who's 30 coming into the CVICU instead of the lady who's 80.
I see. Well, if our viewers, if they have a family member or a friend who goes through cardiac surgery, what are some things to remember as a family member and you have a loved one in that situation?
As a family member, it's important to know that this is, first of all, it's a long surgery case. That is a stressful day for the family. The patient has no idea they're under anesthesia, but it's a really long, it's kind of a marathon day. When our families come back from the waiting room to see the patient for the first time, sometimes they've been waiting for 8 to 10 hours. So it's a long day. So, know to be in for the long haul during that day. there's a lot of nursing care and a lot of physician visits in that first day. And then we try to dwindle off. We try to get the patients up in the chair, awake, off all of the assistive devices by the first day. And usually by day 2, they're sitting in a chair having some Jell-O.
It's great.
Yeah,
That's great.
it is good. It's very uplifting to see someone who was really down and out up in the chair the next day. I think it does a lot for the family.
I've been fortunate to visit with a lot of post-surgery heart patients, and one of the things I'm always amazed by is obviously they have some pain. They've been through a surgery, but they say they immediately feel better relative to their cardiac symptoms.
Cardiovascular surgery, so bypass surgery, is one of those surgeries where you actually totally fix something. So you're taking a blocked artery where the heart was really working to get blood flow, and you give them a new route. It's just like a new road. That's why we call it bypass when we take a bypass off the interstate. You're getting a full new fresh road that you can drive 80 down to feed the heart muscle. So they probably feel like they have more energy.
Yeah.
Now we don't want them jumping up and down and doing burpees because we just opened their chest. But they have a lot of energy. They probably feel more comfortable as far as getting winded easily or feeling short of breath. Things like
That's
that.
wonderful. What about the patient? What should you expect if you're going to be coming in for heart surgery?
As the patient, you should expect, obviously, that first day, you kind of lose the whole thing. So you fall asleep knowing that it's Thursday and you're having heart surgery, and all of a sudden you wake up and it might be Friday and you've lost that whole day. The first day is usually pretty good. You're on some pretty intense pain medicine. The second day is a little harder because we get you up and walking around usually the unit, parts of the hospital. And then after that course, the rehab is pretty intense. So you try to keep up a lot of walking. We try to encourage folks to go through a cardiac rehab program so that they can be monitored, walk farther and further distances. They might feel really good, but they may not be back to normal for many months.
So the rehab actually starts in the hospital?
It does. We have a specialized rehab team for the cardiac service line, and they come see the patient right after surgery, kind of look through their chart and know what to expect. So if you were in a wheelchair before surgery, they know that they're not going to get you skipping down the hall afterwards. They come and they visit the patient first day and help with some marching in place. On the second day, we try to walk around the hallway. On the third day, hopefully they're almost out of the hospital and they're walking around the hallway in the telemetry unit. And then we also offer that outpatient at Methodist, and that's done at the Jewish Community Center here in town. And they do monitored treadmill work up to, as long as the patient can tolerate. And that's a good way for someone to have a little peace of mind, because going through cardiac surgery, you're worried, you're on the monitor, and then all of a sudden you're home and you're like, well, I hope it doesn't stop beating. Right. So it's good for them to have a peace of mind that someone's watching me. Look, great, my heart's working great while I'm on the treadmill. Gives them a little bit more confidence at home to continue.
So a little more time, and you mentioned this to a certain extent, but how quickly can you expect to be back to normal?
It varies depending on what you were doing before surgery. Someone who was typing at a desk for a while, you're going to have a period of time where you're not supposed to drive, you're not supposed to lift anything greater than 5 pounds with your arms because it's just a huge strain on that muscle and bone that we cut. So you're going to be limited in those activities for a few weeks to a month. After your surgeon releases you and you feel good, you're still going to have some of those limitations, but you could go back to work if you were a secretary versus if you were a construction worker, you might not be able to.
Thank you very much.
Thank you.
It's time for a quick break. Up next, we're going to talk about heart attacks, what you need to know. We'll be right back.
Make a difference. Pass it on. A message from the Foundation for a Better Life.
Thank you, dear, very much.
You're welcome.
Thank you.
You make me feel so young. You make me feel so spring has sprung. And every time I see you,
You're not fooling anybody, you know. Think young. Pass it on.
the moment that you speak,
A message from the Foundation for a Better Life.
play.
Welcome back. We're talking with family nurse practitioner Lisa Crenshaw. Lisa, welcome.
Thank you.
Glad to have you on the show.
Glad to be here.
Well, we're talking about heart disease and heart attacks, but tell us what type of patients do you take care of?
I get to see the patients from the time they enter the emergency room, through their hospital stay, through discharge, and occasionally I get to go to the offices and see them in the clinics.
So really along the full course.
Right.
That's great. Well, how common is it for men and women not to realize they're having a cardiac event or an
It's
issue?
very common. A lot of people don't experience true chest pain. They will experience shortness of breath or fatigue or a weakness, sometimes even palpitations, and they just attribute that
But
to...
it's always indigestion, right?
Or indigestion, yes. They do get to have indigestion, and they'll take their Tums or anything for that.
But it's we like to be in denial, don't we?
We do. We always deny.
Now, I mentioned men and women, but can men and women have different symptoms?
Men and women do have different symptoms. Men usually have those classic symptoms where they grab their chest and they have the true chest pain. Women and diabetics tend to have more shortness of breath, fatigue, weakness.
Okay.
They just can't clean the kitchen like they were cleaning before.
Okay, but not necessarily acute.
Not
Clenching
necessarily
pain.
acute clenching chest pain.
So I guess that makes it a little harder even to make a decision that you
It
need to see someone.
is. Sometimes when they come to the emergency room, they're dismissed because they don't know that that's what they're having is true cardiac pain.
So with heart disease, what are some warning signs that we should be watching?
Any kind of change in your daily energy levels. Sometimes people just are more tired, they feel weak. Sometimes people have palpitations where they feel their heart racing, and that's an indication that that heart muscle's not getting enough oxygen or blood supply.
Okay. What should we do if we know someone that we believe they're having a heart attack?
We should call 911. There's a big push to activate EMS first instead of trying to drive ourselves to the hospital. The EMS system can start treatment much quicker, and the nitroglycerin, oxygen help control the symptoms.
So that's even more important than if you're trained, and we hope you are. We want lots of folks to be trained in CPR.
In CPR.
It's more important than starting CPR.
Right.
Call 911
Call
first.
911 first. Then you
Good.
can start CPR.
I see. I see. What do you experience after you've had your heart attack?
A lot of patients become very emotional, very sad, because they have had a life-changing event, and most people are relatively healthy prior to their event, and once they do have the event, it's life-changing, and you've got to make life-changing changes to your daily life.
Now, we had Kristen on earlier, and it was talking about kind of the surgery and in the rehab. Have you had experience with patients and going through the rehab, and can you talk about that?
Right. The patients actually look forward to the rehab. Their family members look forward to the rehab because that 2-week period after heart surgery and then to the start of rehab, they don't quite know what to do, what their limitations are, and cardiac rehab can give them the good guidelines as to what activity they can start to do.
Beyond rehab, do a lot of these patients, is it a life-changing event for them?
We hope that it's a life-changing event, that they don't reverse back to smoking, or they start to take note of their nutritional status and try and lose weight and just live a more healthy lifestyle.
You mentioned in the beginning that you don't just take care of patients that have had surgery, but also patients that have been to the cath lab. I know it's a broad area, but can you talk a little bit about diagnosis and intervention in the cath lab and how that course of treatment goes?
When the patient presents with chest pain, shortness of breath, they go to the cath lab and they undergo a cardiac catheterization, where we're able to look at the coronary arteries, inject a small amount of dye, and look for the blockages. Most of the blockages can be amenable to balloon angioplasty and stent, depending on the location, what they're made out of, if they're calcium or if they're made out of thrombus.
So if they're going to be able to do an angioplasty, kind of talk through what is that?
The angioplasty is actually the expansion of a balloon within the artery to push the plaque up against the wall.
And that balloon gets into that artery how?
We go in through the femoral artery.
Okay.
We are doing some radial cases where we go in through the arm.
Through the wrist?
And but it's a small catheter is thread up to the heart over the aortic arch. There are 3 major blood vessels that wrap around the heart muscle. We take and touch the tip of each one with our catheter, inject a little bit of dye, and look for the blockages. And then we slip the balloon in through that, expand it open, and push all the whatever out to the vein, in the artery, and then we put a stent in through that.
So in essence, it's like open it up and for a very general lay description, it's kind of like a straw or a tube inside that artery. Okay. Now, before we're talking about something really invasive with opening the chest. What was the patient feel like after an angioplasty?
After an angioplasty, there's very little pain involved. We've numbed up the site. The heart muscle itself does not have nerve, or the arteries do not have the nerve endings, so they really don't feel a lot of pain afterwards.
Okay. And is it fair that the patient will feel that same effect that the road is open, so to speak?
Yes, they'll start to feel more energy, more, they're ready to go home.
Get out and do stuff.
Yes.
Well, I kind of come to the end of our segment. We've talked about intervention a lot, but what can we do to help prevent heart disease and not get to a surgery or an angioplasty?
Live a healthy lifestyle. Maintain a low-fat, low-cholesterol diet. Avoid obesity, and really watch your weight, and exercise. They like to see us. The guidelines suggest that we exercise 40 minutes. 40 minutes a day, 4 or 5 times a week.
Okay. And have good genes.
And have good genes. Yes.
I really appreciate you being with us.
Thank you.
Thank you very much. Still to come, the important role that food plays in fighting heart disease. Stay with us.
I see trees of green, red roses too. I see them bloom for me and you, and I think to myself, what a wonderful world. Oh, yeah.
GHS-TV has a new website. You can now view any of our shows on our new media pages. Or check out the latest Wake Up Germantown or Red Devil postgame. As always, we're streaming live 24/7. Just visit ghstv.org today.
Welcome back. Jessica Adams, a dietitian with Methodist Healthcare, is here to share with us the important role nutrition plays in the fight against heart disease. Welcome.
Thank you.
Glad to have you on the show.
Good to be here.
So, what can we actually eat to help us prevent heart disease?
Well, you can eat foods that are low in sodium. That's going to help decrease your chance for high blood pressure. You can also eat a lot more fruits and vegetables. That's always a good way to go. Everybody needs to eat more fruits and vegetables. Also eat lean meats, so make sure your chicken doesn't have skin on it. Make sure you're not getting the fattiest cut of meat possible. Watching your fried foods. Also, you want to make sure you're eating your good fats. You don't want to eat a lot of saturated or trans fats. You want to eat more of the unsaturated fats, which is going to be olive oil, canola oil, avocados, nuts, seeds.
So, where do Doritos fall in there?
They may be out.
Got to cut out the
They're
Doritos.
They're not falling in those categories.
That's disappointing. So you mentioned some of the things with this question, though, but steps that we need to take to help prevent heart disease. You were kind of going that way, but how you prepare your food, I guess.
Yes, how you prepare your food is going to definitely help, and preparing it in general and not eating out as much is going to be very beneficial, and have a game plan when you go to eat out, but making your food, cooking it with olive oil, using less salt, using more pepper, vinegar, lemon juice, lime juice, cooking things with really strong vegetables like onions and peppers to add the additional flavor without all the things that will clog your artery up.
So you mentioned things that are kind of bad, and you mentioned a little bit of this too, though, but how do foods that help our body, how do they work that help our body fight heart disease? How does that go?
Well, like low sodium foods are going to help not cause you to have blood pressure, which is one of the diseases that can cause heart disease.
Right.
Fruits and vegetables have great antioxidants in them and vitamins and minerals that are going to help you prevent heart disease. Keeping your weight down. If you're eating like this, you're keeping your weight down, letting your heart not have to work as hard.
When we'd like to think that we all prepare our food at home, but I know at least we know in the community that doesn't necessarily happen. Even in a lot of our supermarkets, a large portion of what's there is actually prepared food. If we don't have time, or we don't think we have the ability, and we go out to restaurants more, are there some rules of thumb about where we would want to be or what we'd want to eat when we go out to try to do better?
Mm-hmm. When you go out, try to stay away from fried foods with lots of gravies and sauces on them. You can ask for those on the side. Try to choose things that are roasted or baked or grilled, or you can ask them even to not put as much salt on your food.
Okay, that's good. Good advice. How about caffeine? We hear a lot about caffeine in coffee and tea. Is caffeine really bad for our heart?
Okay, so green tea, if you're talking about green tea is good. It has good antioxidants that are really great, which are called flavonoids, and it doesn't have as much caffeine as you think.
Okay.
It's only like 35 milligrams for 8 ounces.
Okay.
Coffee, on the other hand, there's so many studies on coffee. 1 to 2 cups, though, is definitely okay. 1 to 2 cups, American Heart Association says it's great.
Now
There's
that's
so much,
per hour or per day?
That would be per day.
Okay.
Sorry, avid coffee drinkers.
Yeah.
But there's so much research. There's still researching coronary heart disease if it causes that. It is linked to increasing blood pressure, which can cause heart disease or stroke. There's other research that says that it's good at helping to prevent cardiovascular diseases such as diabetes, or diseases that can cause cardiovascular disease like diabetes. But safe to say 1 to 2 cups.
So kind of
on the safe side.
Don't go crazy with it.
Don't go crazy with anything.
That seems to be one of the takeaways. It's interesting with nutrition because there are things that, like coffee, that can be really bad, or they can have some positive effect. Next one's chocolate. Tell us about chocolate. I know folks will be thrilled. Is chocolate good for your heart?
Dark chocolate has those good antioxidants, flavonoids that green tea has. So yes, dark chocolate's good.
Okay.
In moderation.
Okay, what would define moderation for us?
I mean, you can have a couple pieces of dark chocolate. You never want to go overboard on anything.
Okay, good. Moving on to another, drinking red wine. We hear red wine is supposed to be good for your heart. Is that true?
Once again, it has those flavonoids, the really good antioxidants. Okay. But the recommended amount is for men 2 glasses and for women 1. And a glass is about 5 ounces.
Okay. And that's per day?
Per day.
Okay. That's good. Now, is it just red wine? It's not alcohol, any alcohol. It's just red wine?
Red wine's good, yes.
Okay. So you get into beers that are heavy carbs or other things not even like a little less good, like not good, right?
Not good for the heart.
Okay, okay. Boy,
Sorry,
this
it's a
is
lot
settling,
to take
isn't
in.
it? So we're going to move on. We've went through chocolate and coffee and tea and wine. Now, if we just really have to have a big cheeseburger and French fries, should we just like go ahead and reserve our ICU bed?
Every once in a while, it's not going to hurt you if you eat that. Not on a weekly basis or anything.
Not on a weekly basis?
I wouldn't say on a weekly basis, no.
Okay.
We always encourage you, I mean, try to choose a heart-healthy lifestyle. If you're trying to pick heart-healthy foods, then you're doing pretty good. But if you would like to make that cheeseburger healthier, you can choose leaner cuts of meat. At the store, they'll sell 93% meat, 7% fat. You can grill it yourself. You can skip the cheese. Okay. And to be really good, you could sub a salad instead of the fries.
Okay. How about we hear a lot about carbs too, carbohydrates. What about the breads? Does that have a heart effect?
There is a recent study that shows that increased carbohydrate intake, so your processed foods, there are good carbs that are okay. But if you eat too much of those, it can cause inflammation in the arteries and then not help with the clogging because of the inflammation. Everything in moderation, once again.
So if I have to have that burger, I want a lean burger that's grilled with no cheese.
Correct.
And maybe have it on a salad.
Yeah.
And I would be okay.
Or if you choose some whole grain bread, that's okay.
But even that every couple weeks? Woo, okay. All right. Well, we need to know these things. Yes. That's important. So you've told us a lot of things that we shouldn't do. Give us tips on how we can make doing the right thing easier.
I think that everything that I said is a lot to take in. So I think just picking a few things that you know that you probably need to work on is a good start.
Okay.
So if it's the eating out, then try to cook at home more. If it's a lot of processed foods that you have in your cabinet, try to clean those out and try to make an effort at the grocery store to choose more fruits and vegetables. So just start with a few steps.
In moderation. Moderation.
Yes.
Thank you very much for being with us.
You're welcome.
That wraps up our show for today. I hope that living well will help you and your family lead healthy lives. Thanks for watching. I'll see you next time.